Hello dear patients and our followers. I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic, Istanbul. Today we would like to share with you the journey and experience of one of our patients. This is a 33-year-old white male. He came to our clinic with a neurotype 3 to neurotype 5 of the hair loss. Every once in a while, we call it a mixed type of the hair loss. In the front side, the front hairline, the temples, and the parietal sides are closer to the neurotype 3 of the hair loss, and the crown area receding and hair loss is close to neurotype 5 of the hair loss. For this type of patients, on average, we may need the numbers changing between 3,500 to 4,500 grafts. Of course, number of the grafts may change from patient to patient, depending on the size of the recipient area, the density you want to get, expectations of the patient. But the most important, of course, for every patient is the capacity of the donor area to give a sufficient number of the grafts. The plan for the surgery was the reconstruction of the front hairline, filling up the gaps in the front side, the parietal sides, and covering the crown area. For the hairline, we tried to keep his original hairline or the remnants of his original hairline. One of the most frequently asked questions we get in the clinic is that what my hairline would look like. And we answered that the thumb up rule number one for the hair restoration surgery is to keep the hairline really conservative, as high as possible, and slightly narrow at the corners. So it gives us the chance to give the patients more coverage and the density instead of just getting the hairline lower. Of course, this rule may change from patient to patient depending on the degree of the hair loss on the North Hamilton scale. So the plan was to reconstruct the front hairline with preserving the initial line, covering the front line, temples, and parietal sides. And the second priority was the crown area. The number of the grafts the patient had was 3,800 grafts. Out of this number, around 2,000 were used in the front hairline and parietal sides, and around 1,800 was used in the crown area. After the surgery is done, we have a routine follow-up schedule for all of the patients who undergo the hair transplantation, bead transplantation, or eyebrow transplantation surgery. Of course, this follow-up schedule may vary from patient to patient, but for the hair restoration surgery, it's around week 2 after the surgery, so we can see if all the scabs are gone, first month, third month, 6 months, 9 months, and 12 months. Now we'll follow up the change of the patient from start to the end, starting from day 13 or roughly 2 weeks after the surgery, then the first month, 3 months, and so on so far. Here we see the pictures of our patients on day 13 after the surgery. 13 days after the surgery, we expect all the wounds on the donor area and the recipient area heal, and if the hair wash and hair care after the surgery is done appropriately, just like we educate and teach our patients in the clinic, all the scabs of the crust should be gone, and you should see the tiny small hair growing outside of the implanted areas. And we can see here that all the wounds has healed, all the crust and scabs are gone, so it means that the good hair care and wash was done for this patient. All the areas are clean, no active wounds, no sign of infection, no discharge, no bleeding sites, so it's a really good healing and recovery after the surgery. Now we are switching to first month after the surgery. Around 1 month or roughly 2 to 4 weeks after the surgery, at this point we start to notice that newly transplanted hair start to shed off. This is called the shock hair loss, and it's perfectly normal biology of the hair. At this point, the hair will shed off, and you will only have that slight reddish or pinkish discoloration across the areas that were transplanted. At this point also, we also advise our patients, due to the growth or uneven growth of the hair in the donor area, we tell them that they can have their first haircut as well. So the healing has gone well. The transplanted hair, if you compare to the second week after the surgery, we can see it's already shedding. There are only pinkish or reddish areas in the transplanted areas. So the healing has started, and the shock loss, the normal evolution of the hair after transplantation, is going on. Now we are on the third month after the surgery, and we can see for this patient that the regrowth of the hair is slowly starting. We expect to regrowth of after the shock loss around 2 to 3 months after the surgery. For some patients, it may take up to 4 months. We can see that newly transplanted hair, they've started to grow. They're slightly thinner at the beginning, but still you can already see the architecture and anatomy of the hair at this point. And after that, we go to the 9 months after the surgery, when the patient had already grown most of his hair. So you can see the areas have been covered, the crown area is covered, the growth is still going on, the maturation of the hair follicles after the surgery is going on. And now we are going to exactly 1 year after the surgery, and this is the result. Most of our priorities like rebuilding the front hairline or rebuilding the line that separates the forehead from the skin of the head or demarcation line is fully restored. The hairline is high. We preserve his natural hairline. It looks really nice. It doesn't seem something unreal or unnatural like a baby doll like. And in the crown area, the maturation is still an ongoing process. For the front area, most of the growth and the maturation of the hair follicles finish around like 12 months. But for the crown area specifically, the growth and the maturation of the hair follicles may last about 18, in some cases up to 24 months. So basically, hair restoration surgery isn't like we do the surgery and the patient comes out of the clinic with the full head of the hair. It's a journey. It's like growing a baby. We need to give it the time. It goes like implantation, growth, shedding, regrowth, and after that maturation. Thanks and stay tuned with us.